Good morning, everybody, and thank you for this great opportunity to be here today. As many of you know that have followed this meningitis outbreak, it has been quite a chaotic year for compounding pharmacy as well as practitioners and patients alike. Let me go start here with a couple just disclaimers. Let me find also the clicker up here. Is this it? I think this is it. Let's see if I'm going the right direction here. Okay, just disclosures. I don't have any financial interests or product development that would in any way conflict with what I'm talking about today. I want to put that on the record. This information that I'm going to provide to you is from a lobbyist government affairs perspective, not legal advice, but it's just information on what's going on federally and at the state level that may impact your respective practices. And then the learning objectives for today, hopefully after this session you'll be able to describe the economic and healthcare trends which will affect compounding over the next 5 years, list 3 evolving areas in therapies which will be tailored by specifically tailored medication therapies, and compare federal and state oversight of compounding pharmacy practice and the impact that will have on practitioner and patient care decision making. Just out of curiosity, how many of you in the room know exactly what compounding is? Okay, I'll make a quick analogy here that might help a little bit. It's essentially like going out and getting Betty Crocker cake mix. If you go get the cake mix and you mix it, you're mixing the components of that, and that is essentially compounding, as opposed to going to the grocery store and buying the pre-made cake. That would be the manufactured cake versus the compounded version, which is the one you make at home with a kit. Obviously, though, compounders do indeed have regulations at the state and federal level with which we must comply, but that's kind of a brief analogy as to what it is. Compounding pharmacies do traditional pharmacy work. They fill prescriptions with both manufactured branded drugs, generic drugs, but those folks that do compounding also do either sterile or non-sterile compounding. Sterile is the injectables, the more high-risk medications because they're going directly into your bloodstream. Non-sterile are typically the tablets that you ingest, creams, etc. And those folks that specialize in compounding do much more custom, tailor-made medication at the doctor's request per script. This is not something that they do and then they go out and they sell the products. They're pharmacies, they are not manufacturers. And we'll get into a little bit more of that as we go on. The other thing that's very important to remember is that pharmacists need to have a triad relationship. They need to have a relationship with the doctor who's prescribing and with the patient who's coming in to get the script filled so that they can provide advice to the doctor as needed. What we don't like to see, and this is what happened with the NECC case, which we'll get into here in a moment, is you basically have a pharmacy that's choosing to be a mass producer of medications and is clearly overstepping the line between pharmacy and manufacturer, yet not wanting to comply with the standards that are required of manufacturers. And that is what happened in the NECC scenario. Moving forward here. Why do people need compounded medications? Dosage adjustment. A lot of manufactured, branded pharmaceutical products are only in specific dosage forms. We can offer medications that are alternatives in different forms and a form change. For example, if you wanted to make something that may be an injectable into a cream, especially for elderly patients, for example, that's not as hard on the liver, for example, that's something that a compounding pharmacy can do. They can change it from whatever the existing dosage form is into another form, whether it be a cream, and a type of pill you can swallow, etc. Removal of allergens. This is a big area of growth for compounding pharmacies. A lot of those drugs that are manufactured and branded do have components in them to which many people react, especially autistic children, a lot of geriatric patients as well. Again, we can improve adherence to their prescription taking every day by eliminating many a mass quantity of pills they have to take per day and putting some of those medications together in maybe 1 or 2 tablets or creams, et cetera, so that can help the patient. And then again, drugs that are no longer either available or they're formerly on a list of shortage drugs. We know that a lot of the cancer medications were on shortage. A lot of the compounding pharmacies stepped in and were able to provide those drugs because they were in shortage. So we've been able to help where those shortages exist. And again, the types of patients that compounding pharmacies serve, in particular, a lot of autistic children. We have to remove a lot of the metallics from the commercially branded drugs. And depending on the type of the patient, the severity of the autism, where they are on the spectrum, they can tailor make those medications, again, per the doctor's script for that particular patient. Treatment of aged patients. Again, a lot of the dosage forms for manufactured medications can be too high, too strong, where that elderly patient may react to that. We can dissipate some of those concerns by changing either the dosage level or the dosage form. Customization. This is a big area. Bioidentical hormone replacement therapy. Many of you know that the Women's Health Initiative came out with the branded hormone replacement medication and related it, directly linked it to breast cancer. So there's been a lot of concern over the years whether or not hormone replacement therapy is even worthwhile. That is one of the areas that a lot of our pharmacies are growing, but also is an area that is becoming more heavily legislated and regulated, and I'll get into that later as well. And then pain management through transdermals. This is a big area of growth, especially through pain creams, which are not nearly as addictive, or frankly they're not addictive, as opposed to the opiates. And we're finding that especially with a lot of the military veterans, a lot of seniors that tend to have some addiction problems, if they get on some of those opiates, these pain creams have been really successful. And these are some areas where the prescribing of compounded medications are growing as well. Community setting, community pharmacy settings, hospitals, home infusion, home care, long-term care and skilled nursing facilities, hospice, and a lot of veterinary medicine, but I won't get into that because I don't believe any of you have a big concern there. But again, they're just very, I think as we evolve, a lot of patients are going for more, specifically tailored medications for their particular needs, and it's been quite an area of growth. But getting into the general perception of compounding, which has not been helped, by the way, with this meningitis outbreak. These are some images that come to mind to people when they think of compounding. This from What a Wonderful Life, as many of you can remember, he basically almost kills a patient with what he's trying to compound. And of course, many of our foes will bring up examples like this and say how careless and unregulated we are. Well, that was however many decades ago. That is not the case today. As a matter of fact, compounding is probably one of the more heavily regulated areas of pharmacy because of many of the developments over time. This is a question for you all, and I'll see how many of you can answer this. Compounded medications, A, must be shown to be safe, B, must be shown to be effective, C, may only be prepared with FDA-approved drugs, D, A and B, or none of the above. Do any of you think you know the answer to that? D, no. C is correct. And notice that it may be prepared with FDA-approved drugs. When it is prepared with an FDA-approved drug, what you essentially have to do is you have to take that pill and you have to crush it, and you have to remove parts of the, it's a very difficult process for a compounder, and that's why most compounders want to work with active pharmaceutical ingredients so they can make a very pure and very accurate dosage. However, the federal government, through Medicare, will not reimburse for compounded medication that does not have a component of an FDA-approved drug product in it. So if it's compounded from bulk APIs with no FDA-approved product in it, it is not reimbursable under Medicare. It is under some third-party payer plans, but even they're starting to pull back a little bit on those payments because a lot of people basically have piled on after this meningitis outbreak. And by the way, A and B have to be proven by manufacturers of medications, but not by compounders.